Today's webinar, Press Pause on the Parvo Panic, Preventing a Case from Becoming an Outbreak, is brought to you by our friends at Elanco. Dr. Brian DiGangi is a clinical associate professor of shelter medicine at the University of Florida College of Veterinary Medicine. After earning his DVM at UF in 2006, Dr. DiGangi completed a rotating internship in small animal medicine, surgery and critical care, a residency in shelter animal medicine, and received his MS in veterinary medical sciences in 2010. Dr. DiGangi has published peer-reviewed research on canine heartworm disease, veterinary field clinics, feline adoption, pregnancy detection, and immunology, and authored textbook chapters on sanitation and asepsis, infection disease management, animal welfare, and animal relocation. He is the lead editor of the second edition of Animal Behavior for Shelter Veterinarians and Staff, is board certified in both canine and feline practice and shelter medicine practice by the American Board of Veterinary Practitioners, and is an elite Fear Free Certified Professional. Dr. DiGangi has served terms on the executive board for both the Association of Shelter Veterinarians and the American Heartworm Society. Prior to rejoining UF, Dr. DiGangi worked as Senior Director of Shelter Medicine for the ASPCA, providing consultative support for 180 animal shelters nationwide engaged in animal transportation and relocation efforts. Welcome, Dr. DiGangi. We're so excited to have you tonight, and I will turn things over to you.
Thanks, Natalie. Thanks for having me. It's great to be here. Thanks, everybody, for tuning in tonight. We've got quite a crowd with us, so I appreciate you all tuning in to talk a little bit about parvo disease. And as Natalie mentioned, my specialty is shelter medicine, so that's the perspective I'm going to be bringing tonight. I'm going to talk a bit about population level issues and how that impacts the animals in our care, but I promise you that all these things I'm talking about will be relevant regardless of if you're practicing in a shelter or community medicine setting, or if you're in a private practice and work primarily with individual pets. So with that, I will kick it off, and just want to mention and thank Elanco for sponsoring me, for sponsoring us tonight. And I am, when we get to the treatment section, I am going to talk a little bit about their new parvovirus treatment product. So stay tuned for that. All right, so I want to invite everybody to join in on some polling. I'll have a couple poll questions throughout the presentation tonight so that folks can engage a little bit. We can find out a little bit about your background and what you're learning as we go through. And so the QR code up there should hopefully take you to the first poll question. Or you can also just enter the web address that you see up there in your browser if you're in front of a computer. So either way should work, and you don't need to register or put your name in or anything like that. You can just skip over those pages if it asks you for any of that. So I'm just giving folks a minute to scan that QR code, and then that first question should hopefully pop up for you all. I see folks are chiming in already. That's great. So if you primarily work in a shelter, whether you're a veterinarian technician, a trainer, you can choose option A. If you primarily work in a private practice setting, choose option B. If you are on the leadership or management team, choose option C. And then if I didn't capture you in any of the above categories, go ahead and choose option D. And so give us an idea of who's with us tonight, particularly looking to see how many sort of shelter-minded folks we have versus folks that work primarily in private practice. And so we've got a good mix. We've got a lot of people in the something else category, so I'm curious who I've missed. I saw a number of trainers chiming in the chat earlier, so maybe you're putting yourselves in that category, but feel free to select A or B as to whether you work in a shelter or private practice as well. But we've got quite a good spread, so great. Thank you for doing that. And like I said, there'll be a couple questions coming up just so you guys can continue to participate. So kind of launch right into it from there. And so what I'd like to do tonight, we're going to talk a little bit about the resources that are needed to manage parvovirus in shelters. But like I said, these principles are going to apply to clinics anywhere where you have more than one animal in your care. And that's going to be many of our private practices as well. Maybe you work in a boarding kennel or a training kennel, and you have some concerns about parvovirus as well. And so what are the resources that we need if we're thinking about doing something with canine parvovirus? How can we do that in a way that respects the fear-free principles? We're going to spend some time looking at gaps in preventive care and biosecurity that increase risk. And so I may not call it out specifically, but I'll say it now. Of course, prevention, preventing disease is going to be the most fear-free thing that we can do and the best way we can care for these animals. So I'm going to spend a little bit of time highlighting that. And then, of course, we're going to talk about the impact of some different treatment options, some new ones or some ones that you may not have considered before, and think about how they can impact the levels of FAS and frustration in the animals that we're treating, and how we can actually use them to our advantage, both to care for the medical condition of the animals, but also to protect their behavioral health and welfare as well. All right, so here is another question for you guys, and just get an idea of how much parvovirus are you seeing, and how frequently are you seeing it? So when was your last parvovirus case? Is it sitting in the clinic right now? Was it last week? Was it last month? Was it last year? How often is this an issue for you all? All right, so we've got some good responses coming in. Many of you are saying it's a yearly occurrence. And then another good chunk is in the last month, last week category too. So I'll add this, that when I give this version of this talk that's primarily to shelter audiences, as you might imagine, the options or the responses go in almost the exact opposite order than what you're seeing here. So 5 minutes ago is usually the one that's the most got the most responses, and then it trickles down from there. So it's really interesting to see the differences based on the different type of work that people are doing. And so what that really says to me is that this is a problem that everybody is facing. It's in all of our communities, whether you're seeing it in your particular area of work or not. It is everywhere. And so that is part of the problem. That's why we're still talking about parvovirus, 40 some odd years after its discovery, after we have a really effective vaccinations that are available to us. It's still a problem. It's worldwide. It's everywhere. This is just a colorful map that I found in a research paper that was looking at the different variants around the world, and just emphasizes the point that it's everywhere. There's lots of different variants of it out there. That's a real Google search screenshot that I put up there. The general public knows about parvo and they're concerned about parvo. So this is something that we see year round as well. Sometimes there's talk about seasonality of parvo, and while you may see fluctuations in your practice or in your community, there are studies that support different seasonalities in different locations and in different types of practice. So again, something that's kind of a constant threat, even though we've known about it, we kind of know how to deal with it for many years now. So why is that the case? Why is it continue to be a problem despite effective vaccination and fairly effective treatment protocols as well? Really important things about the virus that are important and how we manage it. It's highly contagious and really hard to kill. So this is a non-envelope virus like calicivirus, like adenovirus. It's a non-envelope virus, which means we have to use really particular disinfectant and sanitation protocols, which I'll talk a little bit about later, to make sure that we actually kill that virus. The other thing that's really important to understand is the way that parvo spreads. And so, veterinarians will tell you that it spreads by fomite transfer, mechanical vector transfer, transmission. And it's really important to think about, what does that actually mean in the daily life of a pet and a pet owner, and all the different ways that we interact with those animals, whether it's in a shelter, whether it's a privately owned pet, whether it's in a clinic or kennel setting. And that's why I have the graphic up there on the right, because I think it does a nice job of really breaking down what are all these common things that we do every day that are potential mechanisms for parvovirus to spread. So what else is the problem when we get to animals that are infected with it and we're looking at treatment? Concern is that treatment is fairly expensive. It's very intensive. I know there was a number of technicians in our audience tonight. You guys know better than any of us how intensive the treatment and the monitoring is associated with parvovirus cases. And of course, it's time consuming for everybody involved too. And so even though we have mechanisms to deal with it, it takes a lot of resources to do it well. And so I'll talk a little bit about that on this slide here. And so the QR code on this page is going to take you to a treatment resource assessment algorithm that I made a few years ago now. to help shelters try to understand what are all the different resources that we need if we're going to start a parvovirus treatment program or expand an existing program that we have. What are the different sort of non-medical considerations that are out there? And so that QR code will take you to that document. But I will say that we're working on a new updated one that also includes treatment considerations, and that probably will be available within the next couple of weeks or so. So look out for that. But I just wanted to highlight the sort of big categories that are covered in that resource assessment algorithm. So the first one is facility. And so we have to make sure we have appropriate facilities to deal with parvovirus and do it in a way that protects both the physical and behavioral health of the animals. And so we'll talk a few slides coming up on isolation, so I won't spend too much time here on that. But the components of facility that I think about are having an appropriate isolation space and having dedicated supplies that are used for that space so that we don't contribute to disease transmission in the facility that we're working in. The second bucket there is staffing. And so we have to make sure we have the appropriate staffing. Veterinary support, I should also add on there, especially for shelters and kennels and other long-term stay situations. We want to have veterinary support. We also want to have behavioral team support as well. For those animals, we're talking about animals that are going to be under care for quite some time. And so it's going to be really important that we meet both their medical and behavioral needs. But I'm talking about not only having those staff members available, we have to have a sufficient number of them, and they have to be trained to do the different things that we need them to do to take care of those animals. So a lot of times we think about staff, we just think of, oh, we have X number of people, but we forget about the different roles that we need them to play. And by the way, volunteers might fall under that category as well. We want to think about the time that's involved. So I mentioned this a minute ago, but of course there's time for the treatment itself, but also for monitoring these animals. And then especially for shelter or other population settings, if you're taking time to care for animals that require more intensive care, whether it's medical or behavioral, you're probably taking time away from animals in the rest of your population. So we have to kind of think about what those different trade-offs are going to be. And then of course, money is important to consider as well. We have to pay all the staff, we have to buy the supplies. And maybe we're in a situation where you can actually refer these cases, you have excess money, and you can refer these cases to someplace that's better equipped to handle them in regards to the facility, the staffing, and the time that's available. So big, broad strokes of categories that you want to consider if you're looking at revamping whatever your parvovirus treatment protocol might be. Just a plug for anybody who's working in or with animal shelters. I hope you all have seen the ASV guidelines for standards of care in animal shelters. The second edition came out at the end of 2022. That QR code will take you right to that document there. But I wanted to call out this particular statement because it does talk about the importance of isolation areas. And it says separate isolation areas must be provided for animals with different highly contagious diseases. And those of you who are familiar with the document know that a must recommendation is sort of the highest level of recommendation that is made in that document. For our purposes tonight, I thought it's interesting that it does in particular call out parvovirus infection as one that's really important to make plans for. So as we dive into what does isolation mean and how do we manage that, one more poll question for you guys. So who belongs in isolation? Is it option A, a puppy with vomiting and diarrhea? Is it option B, a puppy that came into the shelter on the same day as a parvo puppy? Is it option C, every puppy that comes in? Or is it option D, a puppy that has only received one parvo vaccine? All right, it looks like most folks are going with option A. We have a handful that are considering option C. And so the answer that we're looking for here is when we talk about isolation, we're talking about animals that have diagnosed with or showing clinical signs of an infectious disease. So option A is truly the correct answer as far as who belongs in isolation. Animals that are exposed to parvo or are at high risk but aren't clinical or haven't been diagnosed, those might be option B, that might be option C. Those animals you might consider putting in a quarantine. So the difference between isolation and quarantine is isolation is for animals showing signs of disease. Quarantine is for animals that have been exposed to disease, and we're trying to wait out the incubation period to see if they actually develop disease. Both of those situations mean that we're holding an animal in different, generally different operational, if not physical spaces to care for them. So that's going to play a role in how we actually take care of those animals. So like I said, isolation is for animals diagnosed with or showing signs of contagious illness. The reason that we want to do this is to prevent further disease transmission and allow us to provide individualized care. And so usually we're talking about individualized medical care for these animals to make sure we're treating them for their disease, monitoring them for their disease. But I also want to make sure that folks understand that's a broad bucket, and that also makes sure that also includes taking care of their behavioral health. And maybe it's even more important during this time because they are physically isolated in many of these cases. And I'll just throw a quick shout out to Dr. Heron is a veterinary behaviorist who has a nice webinar in the Fear Free library on managing animals in isolation and protecting their behavioral health. So please check that out if you haven't seen it, a whole webinar on just managing behavioral health in isolation. And so how do we actually do this in a sort of normal daily basis? It really comes down to making sure you have good biosecurity protocols, and we pay attention to the mode of transmission of the pathogen we're concerned about. And so why I'm calling that out is because I want folks to know that even if you don't have sort of the almost ideal setup that you see pictured in the image here, which you might see in many private practice settings or large hospitals, you can still isolate animals effectively for infectious disease transmission, to prevent infectious disease transmission in a variety of ways. And so I hope folks can think a little bit broadly about that if you don't have sort of the ideal setup that might come to mind when you think about isolating animals. So in shelter, again, you can replace that with in clinic or in boarding kennel or in your training kennel, whatever the situation might be for you. If you have an animal that is showing signs of infectious disease and you want to isolate them, one way of doing that is having a physically separate space that's designated for that particular type of disease. So generally we're talking about either GI disease or respiratory disease or dermatologic disease for most small animal population settings. So you want to have a physically separate space, ideally for each one of those categories of disease and by species. Another way that you could also effectively do this is having designated area within their normal sort of housing location. So there might be a particular row of kennels in the one large kennel room that's designated for isolation, depending on the particular disease that we're talking about. And then the final option for sort of in-shelter or in-house isolation might be just to isolate them in place. And whatever their housing unit is, where they're set up, maybe you put some protocols in place to isolate them there. And that may have some pros and cons to it as well. So they might be mixed in with a larger portion of the population, but they're going to be in a familiar housing environment that's going to be a little bit more comfortable for them and help reduce some of the FAS that might come along with moving them to a different area of the building that they're not used to. Also really important, I want to emphasize that this can be done out of shelter or out of clinic too in many cases. And so we want to make sure that we really make good use of our foster homes. Those of you who have been through a lot of the Fear Free training know that the best way that we can reduce FAS and frustration in our shelter animals is to get them out of the shelter. And so making really good use of foster homes, that they can be for healthy animals, they can be for underage animals, they can also be for sick animals, as long as we have folks that are prepared and trained on how to manage them appropriately. And we choose the cases appropriately for those foster homes. So don't forget about that option. And then there are many shelters and vet clinics that have partnerships where they can better manage those cases in the vet clinic setting as well. So lots of options out there for isolation. So I want folks to feel comfortable that they can come up with a plan that will work for them, assuming they are able to meet all the different resources that we talked about earlier. So here are some photographs of examples of what this might look like in a variety of shelter settings. And so this first shelter you see on the left here, main healthy animal adoption wing is in the foreground over on the left side there for dogs. And there's a completely separate building off in the back in the distance where that yellow arrow is pointing. And that's where they were able to house dogs that had, in particular, respiratory disease. But that was their isolation area, was in that back kennel there. And so this was a completely physically separate building. Nobody had to, there was no traffic flow back there unless they were particularly going there to take care of those animals. So there weren't a lot of opportunities for cross-contamination. And it was its own nice individual setup. So they were able to provide all the needs of those animals in a environment built for that purpose. So there were, double-sided kennels that were available to take care of those animals really easily and effectively. We have another option here over on the right that can also work. So maybe slightly more of a temporary setup, but the same idea, in that it's a physically separate space from the rest of the population. There's probably some good airflow there because you can see the sort of open door that's going into that area where their kennels are located inside. So there are some pros and cons to that sort of a setup as well. Some other options here over on the left. So I wouldn't advocate this particular setup for parvovirus because there's contamination or direct contact between the three individual kennels that you see there. But the idea is that this is another sort of temporary option that can be really flexible and that you can use in different ways. And so there's a concrete pad that's sealed, that can be sanitized, and you can set up those fence panels to make up any sort of different setup of runs that you want. And so you might move them apart depending on the infectious disease you're talking about. If you're talking about fomite transfer disease versus or respiratory disease, where you may not want them to have direct nose-to-nose contact. There's great airflow in this setup. There's nice big cages there that are larger than what you might find in most buildings. So there's more opportunities for interaction and choice in their environment while they're in this isolation space. But again, just another option. And then over on the right, we have what I was mentioning before. So one sort of designated wing off of a main kennel room. So they're sharing the same airspace as the healthy population, which is where the photographer is standing. But there's a nice visual barrier and physical barrier preventing unnecessary traffic into the area where those runs are for the animals that are in isolation. It also has its own separate entry and exit door off to the right there, which is nice. So those animals can go outside and have some outdoor time as well. A few other options. So here on the left, another sort of like a renovated solution. So existing kennel, double-sided kennels existed, but they didn't have a particular area to isolate animals in this shelter. You can see in this case, it was labeled for bite quarantine, but the same principle applies. They were able to put up this relatively inexpensively physical barrier, visual barrier to isolate those animals and to be able to provide the level of care that they needed for their needs. You saw the image over on the far right earlier. So the one in the middle is maybe sort of last case resort, but this can work as well. So again, you've got animals that are just staying in the housing unit where they were, in the same row of kennels where they were being housed. But we've decided that beyond that tarp is where isolation is going to start. So there's a physical barrier, it's a visual barrier. We can have protocols in place to prevent disease transmission across there. And it allows the animals to stay in their kennel. They can still see outside. They can be managed appropriately in that setting as well. All right, and then, excuse me, functionally, how do we make these isolation areas work? So I showed you a wide variety of options there. And so it's really important to have good protocols in place and have the appropriate supplies and equipment readily available for people to use. So over on the left, it's one of my sort of favorite series of pictures from a shelter that I visited that did a really great job of having designated mop buckets and cleaning equipment for each room of the shelter. So it was a set of supplies that were for the green room. They were marked green, handles on the broom and mop handles, had green tape on, and the buckets were green. The room was marked green, and everybody knew that the green equipment went in the green room and never went into any of the other rooms. And they were able to do that for all the different areas of the shelter. And that's a really functional way of making sure that you don't accidentally create opportunities for pathogen transfer just by the fact that you're trying to take care of the animals in those spaces. And so you can do the same thing for all your behavioral enrichment items. You can do the same thing for staff members as well and volunteers if you have sufficient hours of folks. And then I mentioned earlier, making sure there's good signage. So we want to make sure that we know what PPE is required in there for different types of care. And so whether we're providing medical care, we're just going in to provide treatments. Maybe we need a different level of PPE than if we're going in there, maybe stepping into a run, we're going to spend time training an animal or sitting with them and having a lot of physical contact. We might want some different parameters there. So think about what those are going to be, make sure it's really clear for everybody. And then over on the far right, make sure they have all those things available to them right at the place where they need it. So right outside that door where they're going to go into that isolation area and work with those animals. I'll talk a little bit more about PPE in a couple slides from now. So real quickly, I mentioned resources of staff and time before. So here's just another shout out to the ASV guidelines and another quote in there. And so I just wanted to highlight this again, that it's not only the number of staff, but it's their time and it's the skills that are required. So both of those or all three of those things really need to be covered when you're looking at resources of staffing. All right, so moving on to preventive care and biosecurity. Like I mentioned, anytime we can take an opportunity to prevent disease, it's going to be the most efficient, most cost-effective, least stressful thing that we can do for the animals. So we want to make sure we really maximize our opportunities to do that. So there are entire presentations on each one of the topics that you see listed here. And so I'm not going to reiterate all that tonight, but I'm just going to hit a couple of highlights that are really pertinent to the management of parvovirus disease and some common mistakes that I see that are made that contribute to the spread of disease and helping an individual case become a wider issue and in many cases turn into a full-blown outbreak. So the first thing, any of you working with shelters, hopefully know that we have different vaccination protocols that we recommend for shelter animals compared to those that we recommend for privately owned pets who are at our lower infectious disease pressure and at a lower risk. So most of the animals that are coming into the shelters, we know do not have protective levels of antibody titers against common diseases such as parvovirus. So they need to be vaccinated ideally before they come into the shelter, but certainly upon entry into the shelter at the latest. And when we say sort of on admission and on entry, we're talking about within 2 hours of entering the facility. So maybe you're in a shelter, you work with a shelter that can schedule appointments, so many of them are doing that these days, and the animals can come in for a vaccine, and they can wait a week and then be entered into the shelter physically a week later. If not, that's okay. Get them vaccinated in the animal control vehicle, get them vaccinated in the parking lot before they enter the building, or as a last resort, as soon as they've entered the building before they go into the general housing area. The other thing that's different for us in shelter, the animal vaccination protocols is we vaccinate earlier and we vaccinate more frequently because of the high infection risk and high pressure that is there in those environments. And so we want to start vaccinating puppies and kittens as early as 4 weeks of age in the shelter. And we want to booster those vaccines every 2 weeks until they're 20 weeks of age. So that's the protocol if they're staying in the shelter, but it's really important to emphasize that we want to take every step that we can to get those young puppies and kittens out of the shelter. We don't want them to be sitting in the shelter until they're 20 weeks of age. So ideally, they're being raised in a foster home, or better yet, they're adopted. They're not growing up in that sheltered environment. But if they are in that high pressure environment, they do need to be boosted every 2 weeks until they're 20 weeks of age, so we can be sure that those maternal antibodies have waned and those vaccines are going to protect them from those physical health threats. The number of vaccines is not important. I still hear folks that talk about, well, they got 3 vaccines, they got 4 vaccines, so they're good. It doesn't matter. They need to receive that final vaccine at or after 20 weeks of age to be sure it took effect. So that may be quite a few vaccines if you actually started at 2 weeks of age. Storage, handling, administration errors, we still see this frequently as well. So make sure these vaccines are refrigerated. We're talking about modified live vaccine products. They have to be cared for. You want to mix them. You want to give them within 1 hour of mixing up those reconstituted products to make sure that they stay viable and they work. And so I have consulted on disease outbreak situations where folks were vaccinating every animal that came into the shelter on intake as they were supposed to be doing. But because it was such a high volume shelter, the vaccines that were held in the intake area were in a small refrigerator, and the refrigerator was open so many times per day that it never actually got cold, and it would get warm and the vaccines would not be viable. So it's really important to make sure that you check those refrigeration temperatures and follow all those manufacturer directions for storage and handling. It does matter. All right, common mistakes for deworming. In shelter populations, we want to make sure the animals are dewormed for at least roundworms and hookworms. Again, at intake, starting at 2 weeks of age, just like we do with vaccines. We're starting a little bit earlier than you might, and we're deworming more frequently. So make sure that you're repeating that deworming every 2 weeks until they get on a monthly deworming product. And many shelters we're seeing also add in whipworms. Deworming against whipworms on intake as well if it's particularly prevalent in your area or you're just diagnosing it frequently in your shelter population. And on that note, if you're giving them the sort of standard deworming and you find you have a lot of animals that have signs of GI disease, you want to make sure that you go ahead and do fecals on those animals, check for parasites that you may not be considering, or make sure that the deworming is having the effect that you think it is. You may need to adjust that sort of standard deworming protocol to prevent those animals from getting some of those common parasites that you're likely to find. And this will all set them up well for if we do get to the point where we have to treat these animals for parvovirus. One of the key things is to make sure that they've been dewormed and they don't have any intestinal parasites. Making sure you have solid deworming protocols on intake is going to set you up for success if that should be the scenario that you find yourself in. All right, and then common mistakes on diagnostics. So I do occasionally still hear of organizations that are testing all puppies for parvovirus. It's important to recognize that these point of care antigen tests that we use for parvovirus are diagnostic tests. They're not screening tests. They're not meant to be used to screen all animals. They're meant to be used in animals that have a high degree of suspicion of parvovirus or have clinical signs associated with parvovirus. So those are the animals you want to be testing. Be aware of vaccination timing. There are some reports, particularly cats, of false positive test results if they're tested within a week of administration of a modified live virus vaccination. So again, it's a diagnostic test, so it should be used in combination with clinical signs and understanding of that pet's vaccination history. And then if there's some question, maybe even some confirmatory testing to make those diagnoses. All right, so getting to sanitation, we talked about how difficult canine parvovirus and any of those non-enveloped viruses are to clean and to remove from the environment, to actually inactivate. And so some important things that we need to do to make sure that we do that if we're concerned about parvovirus in our facilities. And so something that we see happen often is skipping the pre-clean portion of cleaning and disinfection. So I generally talk about it as two things, cleaning and disinfection, or if we say sanitation, we're talking about the combination of cleaning and disinfection, but it's two distinct steps. And so even if you're using some of these products that have that can do both things, they're sometimes called one-step products, and there are some great ones out there that are really effective against canine parvovirus and all these non-enveloped viruses. Whenever they're in a highly contaminated environment, you still need to clean that environment first with a detergent. You can use that same product if it has detergent activity for that cleaning step, but you still have to do that first, rinse it off, and then apply it again as a disinfectant at the concentration you want with the contact time that you want for what you're doing. So cleaning is always required before disinfection. I promise you, if you read the fine print on the label, even though the one-step products, it'll say that on there. And then the second mistake that we see people make is relying on quaternary ammonium compounds. So we use these for many years, and they worked well, but they did not reliably kill non-enveloped viruses, including parvovirus. So it's important to know what disinfectant you're using and what it's effective against. Even if it says it kills parvovirus on the label, you want to look at those independent studies, because quaternary ammonium compounds time and time again have been shown not to be reliable in real life settings. And so these are common products you might have around your facility, and they have their place. They tend to have really strong smells, which is another reason we might want to avoid them if we're concerned about reducing FAS in these animals that are experiencing, especially the sick animals that were under treatment or in isolation. You want to think about using products that don't have such strong smells, and on top of it, they're not actually killing parvovirus. So we want to avoid those in the situation that we're talking about tonight. And that QR code that you see on there will take you to a nice quick reference chart that we put together at the ASPCA that will compare sort of the pros and cons of the common disinfectant options that are available and used in lots of veterinary facilities. All right, and then final bucket of sort of common mistakes is not using PPE or contaminating the PPE during use. And so I mentioned this a couple times earlier, making sure you have signs on there, folks know exactly what they're supposed to be wearing for what purposes. And set them up for success too. So they don't want them to have to wear all these kinds of excess things if they don't need to be doing that for whatever intervention they're doing in that room or with those animals. So making sure it's tailored to the needs that are there, make sure that they are trained and they know how to put on and remove PPE correctly. And so I'm just going to play a brief clip from a video that will demonstrate what I mean by that.
Shoe covers, gowns, and gloves should be put on and removed in a specific manner. Upon entering the room, use your body to prop the door open and place one shoe cover on as you step over the doorway. Place the second shoe cover on and enter the room. Next, put on a gown and secure the straps around the waist and neck. The gown should fully cover the body from the neck to the knees, including the arms to the end of the wrists, and wrap completely around the back. Finally, put on the gloves, ensuring the wrists are fully covered and the gloves extend over the cuffs of the gown. PPE should be removed prior to exiting the room, remembering that the outer surface of each item is contaminated. First, pull the gown away from your body to break the ties. Next, pull the gown off your body, rolling it inside out as it's removed. As you remove the sleeves, peel off your gloves at the same time, rolling them into the gown and taking care not to touch the outside of the gown or gloves with your bare hands. Dispose of the gown and gloves into the biomedical waste container. Finally, taking care not to touch the outside of the shoe covers with your bare hands, reach inside the shoe covers and remove them one at a time, turning them inside out as you go. As you remove each shoe cover, step over the doorway into the clean area and dispose of the shoe cover in the biomedical waste container. Thoroughly wash your hands prior to moving on to another task.
All right, so that video is available on YouTube and on ASPCA Pro. For training purposes, there's, again, just showed you a segment of it. There's more to that video if you want to look at that and use that in your training. The PPE that you see worn in there, so gloves, a gown, and shoe covers are probably what you would need for most parvovirus treatment areas. But again, like I mentioned before, if you're actually going into a kennel, if you're going to be doing a lot of high contact work with the animal, you might want to wear a Tyvek suit or something that's a little bit different than what's pictured here. All right, so we're going to move on to treatment, some treatment considerations for canine parvovirus. So if you still have the polling up, what 1 or 2 words come to mind when you think about treating parvovirus? Go ahead and put your words in there and we'll start to have a bit of a word cloud develop. So we've got lots of words coming in here, and it looks like fluids and supportive care are coming up really strongly. Give that another minute or so. See fluids, supportive care, antibiotics. Isolation. Money, yep. This is great. That's a really active cloud there. I'll give it another few seconds to see what folks come up with, but fluids really, yep, here we go. Fluids and supportive care are coming up really strongly. So that's a perfect lead into the next piece that I'm going to talk about here. And so if anybody has recently opened up one of their veterinary textbooks and looked up treatment for parvovirus or for acute gastroenteritis, you'll see about 33 different steps, 20 medications, 13 diagnostic tests that these animals need according to the textbooks. And oh, by the way, they'll also tell you that with treatment, mortality is anywhere between 50 and maybe up to 80%. So I would venture to guess that any of the veterinarians and technicians in the audience here are not doing all those things and have treatment success rates that are at the high end of the range I gave you or even higher. And so that starts to call into question some of the sort of dogma that we've thought about parvovirus. And so I want to share a couple of different studies with you that have come out over the last few years that are starting to maybe question that a little bit and help us think more broadly about how we can treat these animals, how we can get them out of, how we can get more animals treated, how we can get them out of the hospital sooner and get them the care that they need. And I meant to mention it earlier with isolation, and I forgot that, you know, a lot of the time we're talking about puppies. And so these are puppies that are often in their sensitive period of socialization. So making sure that we meet their behavioral needs and get them out of that sick area of the hospital, out of the shelter as quick as possible is even more important than it might be in other situations. And so it's great that we have this hard data to back up some of these things that a lot of us do in practice and know are effective. And so the first study that you see, that first bullet up there is one that many of you probably have heard of out of Colorado State University, where they looked at puppies that were treated with an in-hospital protocol versus an outpatient protocol. So they came in, they were diagnosed with parvovirus, they were stabilized, and then went to one of the 2 treatment groups. And they found that it was 90% versus 80% survival in those 2 different groups. So there was no difference in how long they required treatment in each of those cases. The second study highlighted there was done in a private practice. So this was 130 client-owned dogs that were treated as outpatients in this clinic. They had 75% survival with their outpatient treatment protocol, and the cost was between $300 and $400 for each of those pets. Oops. And then the last one up there is data from a shelter-based low-cost clinic in Philadelphia. And in this particular study, there were 95 owners who had elected outpatient care. For whatever reason, the inpatient protocol offered to them was not feasible. And so these animals had 83% survival. On average, they were on fluids, required sub-Q fluids for 3.8 days. Their cost was also less than $500. And so I would also venture to guess that that's much lower. Those costs that are reported there are much lower than what it would be for hospitalization in most clinics for, generally we're talking about 4 to 5 days. And so we're seeing really high success rates at fairly low costs for some of these cases. So we know there's some other options available. And then probably the largest data set that's out there that I want to share with you is from the Austin Pets Alive Parvo Puppy ICU. And so this is a large shelter in Austin, based in Austin, Texas, that has a designated ICU just for caring for parvovirus dogs. And so they reported data of treatment, or they're doing treatment for over 11 years. They had over 5,000 dogs in this data set. They reported overall 87% survival, so really high. If they survived beyond the first 5 days, it was 97% survival. They also provided some of these logistical details, so it cost them about $56 in purely in supply costs for each animal, about 9 hours of labor, so not insignificant there. They also found out that low weight animals and males were at higher risk for mortality in their data set. And so what I didn't tell you was that they had 3 different treatment plans for the puppies and dogs that were in their data set. And they looked at these 4 questions to figure out which treatment plan they were going to go into. So they had an intravenous treatment protocol similar to a hospitalized in-hospital care protocol that you would be familiar with. They had a subcutaneous or outpatient protocol, and then they had animals that they were exposed or at high risk, and so they underwent what they called an exposed treatment protocol. So they had 3 different groups based on the answers to the 4 questions that you see up here, and that determined where they went and how they got such high success rates. So, as you guys pointed out on the word cloud, supportive care and fluids are a huge part of treating parvovirus, and that's the mainstay of treating parvovirus and all that we've had available to us for many years. And so I'm not going to talk about the details of that. There are other sources. There's the textbook for management in animal shelters that you can look up for the latest details on that. But what I do want to highlight are some of the new things that are available to us and some things that we might be able to make use of that might be a little bit more accessible to a variety of pets and pet owners, and have some added benefit of reducing some data that supports their ability to reduce the amount of time these animals are hospitalized. And so you might have heard about some of the things you see on the left. There may be a place for some of those. There's sort of mixed results in the literature about them and whether or not they actually have a clinical impact on the patients when they're used. But we're going to focus on the 3 items you see over on the right. And so to start out, we'll talk about the canine parvovirus monoclonal antibodies. This is Elanco's new product that folks may have heard of now that came out last year. And so this is a monoclonal antibody like others that you've heard of. We're starting to see them enter the veterinary space. And I think many people became familiar with monoclonal antibodies during COVID for treatment of people. And so the way that it works is, as you might expect, the CPMA molecule binds to the parvovirus itself. And this is the really cool part, is it binds to that virus before it actually enters the host cell. And so before the parvovirus has a chance to infect those enterocytes and actually cause disease, it's already bound up by the monoclonal antibody. And so this is the first treatment that is able to directly target and directly treat the virus itself. So as opposed to all the supportive care measures that we mentioned before that are still important and part of this picture, this is the first and only treatment that's available to us to do that. And so after it binds up those viral particles, what it does is it gathers them together, it sequesters them, destabilizes them, and then they are cleared by the normal immune mechanism. So phagocytosis will come and carry them away. And so it's not going to do anything for those viruses that have already infected the enterocytes that are there, but the rest of that viral load that hasn't gotten there yet, it's going to attack them and get them out of the animal system. And so this is some data from the challenge or the efficacy study that Elanco conducted to get approval for this product. And so it was tested on 8-week-old puppies that were challenged with CPV-2B. They were challenged intranasally. And so they had 21 puppies that received the treatment and 7 puppies that received a placebo. And so all these puppies were confirmed to be parvovirus antibody negative beforehand. And then they were challenged with virulent CPV on day 0 of the study. And on day 4 of the study, they were treated with the CPMA, the canine parvovirus monoclonal antibody product. And that was the only treatment they got. So they were treated on day 4. It's a one-time IV injection. That is how it's available for us today. But that is the only treatment that was administered. So they did not get any of the supportive care that we talk about normally. And that was in order to make sure that they knew that any effect that they observed was related to the CPMA product and not the supportive care measures. And so again, supportive care, making sure they were staying hydrated, their blood glucose level is normal, and all these other things are still really important. And so what they found with the study protocol was that, first of all dogs did test positive by the time of treatment on day 4. However, there were 6 dogs that did not have clinical signs at the time of that positive test. So 15 of the 21 did have clinical signs, but these are dogs that you would have identified in your clinic and been able to institute treatment. The other 6 didn't have signs at the time that they got treatment. They did go on to develop signs within 12 hours of the test and treatment. So we know that they actually did get the virus and did get sick. And so just keep that in mind, that we're talking about dogs that were treated really early in the course of disease. And so here's a snapshot of what they found in these dogs. So the blue bar represents dogs that were received the CPMA treatment, and the red bar represents the placebo-treated dogs that were controlled. And so across the board, they found that dogs that received the CPMA product had a shorter time to resolution of vomiting, lethargy, and inappetence. And so that's represented on this graph here. You can see that blue line dips down shortly at day about 4.5, if not day 5. And so about half to 1 day after receiving treatment, inappetence dropped down to a very small percentage of the dogs, whereas those that received the control remained inappetent for the study period. And I can show you a similar graph for vomiting and for lethargy, and it all looks the same. So I'm just showing you the one for tonight's purposes. But again, the CPMA treated dogs had a shorter time to resolution of vomiting, lethargy, and inappetence. And so think about what that means. Those are the things that keep the animals in the hospital, that keep them in isolation longer than they would otherwise need to be. And so we're talking about being able to get them out of those situations of 2 to 3 days sooner than without the treatment availability. So what else did the product do? So you can see a variety of clinical signs and severe clinical signs that these puppies exhibited: vomiting, inappetence, fever, lymphopenia, severe diarrhea, and 57% of the dogs that received the control, unfortunately, did die as a result of their parvovirus disease. However, really importantly, highlighted up there is none of the dogs that received the CPMA treatment died. So they did get severe clinical signs, but it was much more short-lived, and none of them progressed to death. So some field safety data to share with you. Over 140 dogs, client-owned healthy dogs, were treated with the product to make sure that it was safe for administration. No deaths in that group. There were a few mild adverse events, things that you would normally expect to see with any intravenous injection. They were mild, and those animals recovered within 1 day. So last couple minutes, I'll just highlight the other two treatment options that share some similar qualities, in that they reduce the amount of time that's required for these affected animals to recover from parvovirus. And so one is the use of oral recuperation fluids, and these are commercially available fluids that you might have available to you in your practices. Many of them are over the counter as well, but these are designed to aid GI tract healing and improve immune function in the intestines, and encouraging dogs to eat, which we know is a really important component of recovery from enteritis, especially parvoviral enteritis. And so there's one study that looked at these. They had 28 dogs that had parvovirus that were not eating or drinking. They were treated with supportive care, and they were offered water or recuperation fluids twice per day. And in this case, you'll see the dogs that, the red bar represents dogs that received the treatment, versus the blue bar represents dogs that only drank water. And you'll see that the red bar ends much shorter than the blue bar, and these are dogs that started eating a number of days sooner than those that only drank water. And so they found that they had a more rapid appetite return when the dogs drank the recuperation fluids. It was between 1 and 3 days instead of 1.5 to 5.5 days. And they had, of course, greater caloric intake, which again, we know is going to help improve their recovery and let them recover more quickly, allow us to send these dogs home, get them out of isolation, and get them out of hospitalized care. And the final treatment option I want to throw out there that is gaining some popularity and some traction for a variety of diseases, but there is some data on it in parvovirus as well, as fecal transplantation. So the study I'm showing you here was done in 66 dogs between 2 and 12 months of age, also treated with the sort of standard supportive care that you might imagine. And then the study group got a fecal transplant versus the control group that did not. And so this is, if you're not familiar with fecal transplantation, it's just like it sounds. You have a donor animal that is screened for common infectious diseases, and there's a process to preparing a fecal sample and transplanting it into the affected dog. And I'll throw out there that there are some even newer methods of doing this that are going to be even less intense and a little bit kinder to the animals as well, in that there's So sort of the MacGyver way of figuring this out is what's listed on the slide there, but there's also a product that will create fecal, you provide the fecal sample and it will create oral capsules for you to administer to the dogs. And there's also commercially available fecal microbe transplant capsules that are commercially made for oral administration. So you don't have to necessarily do the transplant rectally the way that's described on the slide here, but that is an option as well. So the results from that particular study, so the dogs that got the fecal transplant are represented in the red bars here versus the standard treatment is blue. And you can see that time for diarrhea resolution was much shorter in those dogs that got the fecal transplantation. So it was generally less than 48 hours for those dogs versus between 48 and 96 or even over 96 hours for dogs that did not receive a fecal transplant. So faster diarrhea resolution, again, shorter hospitalization. Let's get these animals out and onto the better environment for them where they need to go. In this particular study, there was no difference in mortality between the two treatment options. So that's on there as well. So with that in mind, sped up a little bit there, so I want to leave a couple of time for questions, but with that information, I would just one more poll question for you guys and get an idea of which of these treatments are you interested in trying, or have you already tried the canine parvovirus monoclonal antibody, or CPMA, as I talked about it. Option A, oral recuperation fluids, those commercially available fluids for oral intake, or fecal transplant. Or do we have a bunch of brave souls who are willing to try anything? Like most of us that are dealing with parvovirus regularly will take whatever help we can get, and we're willing to try just about anything that's out there that might help. So I do see a lot of folks in the category of CPMA, interested in CPMA and wanting to try it all. So that's great. So just in summary here, we talked a little bit about resources, thinking about what it takes to provide good physical care for these animals, good behavioral care for these animals, especially when we need to put them in isolation or treat them maybe differently than the rest of the population. You really want to think about what it's going to take to do that well, and make sure your protocols are set up so that you can do that. Don't forget the basics. I'll say it again, that preventive care is the most fear-free thing that we can do. The least stress that we can provide is actually prevent disease from happening, whether we're talking about physical or behavioral disease. So can't overestimate the importance of preventive care and biosecurity in trying to prevent these animals from getting infectious diseases while they're in our care in the first place. And then when we do get to the point of treatment, let's think about things that can really help speed up their clinical recovery, get them out of that isolated environment, get them onto their homes or out of hospitalized care, whatever the case may be, so that they can go on about their lives. And so I will, my email address is up there. We do have a few minutes for questions. I'll answer as many as I can, but please feel free to email me if you have a question that you don't want to put in the chat, or we don't have time to get to, or if you want some of the resources that were up there and didn't get a chance to get it, I'm happy to send you any of the papers or any of the other resources that I linked to here.